Welcome again in part 2, Introduction to Anatomy. I would like to start with this signboard. All of you must saw a signboard like this in your college. The following words are written on it: anatomy, histology, and embryology. Anatomy is a macroscopic anatomy, histology is microscopic anatomy, and embryology is developmental anatomy. So don't forget about these three sections in your department: macroscopic or gross anatomy, microscopic, and developmental. Another repeated student's question is, how shall I study? Before you want to study anatomy, you must have studied the language of anatomy. As a science, like other sciences, have a special language. The language of anatomy called anatomic terminology. And as it has a strong correlation with the field of medicine or with various specialties of medicine, so it is called anatomico-medical terminology or terms. So you must have good knowledge about this language, and then you will proceed to study anatomy. There is a global position for the human body to avoid the confusion in describing the various human body anatomy. This global position called anatomical position. Sometimes it is called standard anatomical position. Sometimes it is called normal anatomical position. All are the same. Of course, this is not the normal anatomical position. This is a cross-legged position, and this is the not normal anatomical position because the upper limb are flexed towards the midline of the human body. This is the normal anatomical position, and I might guess that the people who made this doll have little knowledge about the normal anatomical position. The body is erected, and the upper limb, the palms, are directed forward. This is the normal anatomical position, which is a global position. The body is erected, facing forward. The eyes looks anteriorly, and the lower limbs are apart, and the palms are directed to the front. This is called the standard anatomical position, like this dot, which, as I mentioned before, it is a globally adopted position. The next topic is about anatomical planes. We have 4 imaginary planes that intersect the human body. In this position, I mean the standard anatomical position. They are the median plane, sagittal plane, coronal plane, and transverse plane. Like the most important one I would like to mention it is the red one, which is the median plane. This plane divides the human body into 2 symmetrical halves. The second important one is the sagittal plane, which came next to the median plane. This is with the black font plane, with this plane with yellow color. It came next to the median plane. So we have an infinite numbers of sagittal planes, but we have only one median plane. Why? Because we have only one plane that divided the human body into symmetrical halves, but we have an infinite or several numbers of sagittal planes. The other green one is the transverse plane, and the blue one is the coronal plane. Now I have several points about the names of these planes. At this picture, you will see the fontanelles or sutures. This is the longitudinal suture, is the sagittal suture. It is ended at the occiput with the lambdoid suture. This like an angle. This is the sagittal suture that extend from the front of the cranium to the back of the cranium. This is the sagittal suture. Coronal suture is like this hair bow of this girl that extend from the side to the side. It is the crown of this beautiful little girl. So this is the crown or coron. I want you don't to miss this term, crown or coron, crown of this girl, crown, coronal, from side to side, from the right ear to the left ear. So this is the coronal suture. Transverse plane, it is very transverse or horizontal, sometimes called axial. The green one is very simple. This picture is also about the body sections or planes. You might see that this is a vertical, sagittal, vertical. Coronal is also vertical. The median is also vertical. We have 3 vertical or longitudinal planes and 1 transverse or axial or transverse. Now you may ask why this is all about. You see in this CT scan, this figure showing a transverse plane to locate the lesion at this brain. It is through the cranium, transverse, transverse figure, transverse plane, transverse section. The other figure also transverse section through the cranium. This is, if you see or if you look to this yellow line, it is a sagittal plane. So this is gonna be the sagittal section. This is the sagittal section. Now this figure, if you look to this yellow line, is gonna be a coronal section. So these are very important in studying the human body. This is also through the pelvis. It is a transverse or horizontal or axial. This is also a sagittal section through the knee joint. So lastly, my facial expression will be like Jim Carrey when I heard about mid-sagittal or parasagittal. Both these are unnecessary. We have only sagittal and median planes. Unnecessary to use by, faulty use by other people, parasagittal and mid-sagittal. They are wrongly used. Next to planes is the terms of movements. I'm going to start with the flexion. You will see in your textbook there is several definitions. Flexion means bending or approximation of the bones or the long bones of the limbs at the joint. My definition is going to be decreasing the angle between the bones to the front or to the back, but in the sagittal plane, must be in the sagittal plane. If you want to flex or extend your elbow, must be in the sagittal plane. If you want to flex the knee joint, must be in the sagittal plane. Flexion of elbow joint will be to the front, but sagittal plane. Flexion of the knee joint to the back, but in sagittal plane. Flexion is subdivided into plantar flexion and dorsiflexion. These are unique to avoid confusion of the movement of the ankle joint. So there are movements of the ankle joint called plantar flexion and dorsiflexion. Dorsiflexion means movement of the foot towards the face, and plantar flexion towards the ground. This is the flexion. When you see this figure, this is a flexion of the elbow joint, flexion of the elbow, the middle person, flexion of the elbow joint, extension of the elbow joint towards the sagittal, and you see the flexion and extension of the knee to the backward, but also decreasing the angle of the joint and still in the. This is the flexion and extension of the shoulder joint, and this is flexion and extension of the hip joint. Now extension is the increasing the angle between the bones. It is to the contrary of the flexion, to the front or to the back, but in the sagittal plane. The same examples are used in this figures, flexion and extension. Now abduction, moving away from the median plane in the frontal plane. Moving away from the median plane in the frontal plane. That is to say, if I want to abduct my upper limb, I should move it away from the center or from the median plane in the frontal or coronal plane. Adduction is the contrary, it moves toward the median plane in the frontal plane. These are an example about, if you want to not forget abduction, adduction. Adduction, ADD means add toward the human body, toward the median plane, add, and abduction away from. If I want to spread away the digits, it is called abduction. And if they are grouped together, the digits, toward the third interdigital, we call it adduction. This is also another name, medial abduction, lateral abduction. Now circumduction, combination of all the former four movements, that is to say, flexion, extension, abduction, induction, is gonna made a circular movement, which, like when I draw a circular movement by my hand, it is called circumduction. Like this, this one at the middle, this is circumduction of the lower limb. Circumduction of upper limb also. This is abduction away from, and this is adduction towards the midline. This is abduction away from, this is adduction. This is the dorsiflexion towards the face. This is the plantar flexion toward the ground. Now is the rotation. It is the movement of a part or limb around its longitudinal axis. It involves inward rotation called medial rotation, or outward or external or lateral rotation. Now pronation and supination, it is also rotational movement of the forearm. It is special to the forearm around longitudinal axis. Don't forget pronation and supination. If you don't want to forget the supination, when you want to move your upper limb, your hand outward, suppose you holding a plate of soup. So soup, supination. Your palm will be directed superiorly, while pronation, when your palm directed to the ground. Another movements special or unique to the thumb called opposition and reposition. Opposition happens when the thumb opposes another digit. Any of the digits by pushing any of the digits by the thumb. Reposition when the thumb return back to its anatomical position. Look to the red arrow. He is catching his hat. Also a position used when you open or close a button, fixing a button of your shirt. Look to this figures, opposition, reposition. This is supination and pronation, flexion, extension. This is flexion, extension of the wrist. This is flexion and extension of the interphalangeal and metacarpophalangeal joints. And now protrusion and retrusion. These are the forward and backward movements of the mandible and tongue, as in this figure. Protrusion of the mandible or of the chin. Retrusion. Also protraction and retraction. This is forward and backward movement of the shoulder towards the chest wall. This is a protraction away from and retraction toward. Protraction and retraction. They are special to the. This is protrusion of the chin. This is a protrusion of the tongue. Another movement is elevation and depression. Moving the part superiorly and inferiorly or upward and downward, like, for example, elevation of the shoulders, of the eyelids, of the tongue, like in this figure, elevation and depression of the shoulder. Now eversion and inversion, this is a special movement or for the foot, when the sole of the foot directed towards the midline, called inversion, and if the sole is directed outward, outward the human body, called eversion. If you check this figure, sorry, eversion and inversion. This is about dorsiflexion and plantar flexion. This is circumduction by the lower limb. This is pronation, rotational movement, pronation and supination. This is abduction and adduction, adduction also. This is external and internal rotation of the lower limb. This movement is a flexion of the elbow joint, flexion and extension at the sagittal plane. This is abduction away from the midline or median plane. This is adduction towards the median plane. This is circumduction, drawing a circle. This is pronation, in which the palm of the hand toward the ground and upward. Few notes about movement of the thumb which might be confusing to some of you. Movements of the thumb are extension, flexion, extension, abduction, adduction. The flexion happened at the distal and proximal interphalangeal joints with metacarpophalangeal joints, like this movement of my thumb, and this is extension, while abduction happened at the metacarpophalangeal joint only. So this is flexion and extension, flexion, extension, while abduction happened at the metacarpophalangeal joint when my thumb became perpendicular to the plane of other digits. This is abduction. Adduction, when it came together with the same plane, adduction with the same plane of other digits. So this is, again, this is flexion, extension, abduction, adduction. Now a new topic is the terms of relationships and comparison. We had superficial, intermediate, and deep scrap positional structure in relation to the body surface. For example, the skin is superficial to the biceps muscle, and the humerus or the arm bone is deep to the biceps and the skin. This figure showing the relation between superficial, intermediate. Superficial is closer to the body surface, and the deep is closer to the core of the human body. Medial and lateral, this is nearer and farther away from the medial plane. For example, at the normal anatomical position or standard anatomical position at the forearm, we have two bones, radius and ulna. The radius is situated lateral to the ulna, ulna situated medial to the, and the same law could be applied to the leg, which has two bones, tibia and fibula. Fibula is situated lateral to the tibia, tibia is situated medial. These are the axes and planes of the human body, showing the lateral, which is outward, and medial, which is toward the human body. This figure is showing the tibia, which is situated medially, and fibula, the yellow bone, situated laterally. External and internal relation to the core of the human body. Anterior and posterior to the front and to the back surface of the human body, also called dorsal and ventral. Like in the previous, this figure, you could see the ventral and dorsal. Ventral towards the anterior and dorsal towards the back of the human body. Rostral and caudal, these two terms are used in the embryology. Rostral means towards the head, and caudal means towards the tail or coccyx, used in embryology. Proximal and distal, this is used to the limbs, these terms used to the limbs. For example, the humerus is proximal to the hand, or the arm is proximal to the hand, etc. This is the proximal and distal, as shown in the red arrow. Superior and inferior, whether toward the vertex of the cranium. Vertex is the highest point of the head, called vertex of the cranium, or toward the sole of the foot. In this figure, you see superior towards the vertex and inferior towards the sole of the foot. Also anterior and posterior, left, right, etc. And this is gonna be the end of my presentation. Thanks for your listening.